So first we're going to talk more in depth about cardiogenic shock. First we want to look at more of the patient assessment findings. For each of the assessment findings, a comprehensive review of the patient's history usually helps in identifying the probable etiology for these types of shock, along with some of the certain medications that they may be taking that be giving the patient these signs and symptoms. Looking at the bigger picture leading up to that particular moment to help diagnose and treat accordingly. So someone with cardiogenic shock, they can be seen with hypotension, no hypovolemia, classic signs of poor tissue perfusion such as oliguria, cyanosis, cool extremities, and or altered mental status, decreased urine output. They can be also seen with peripheral pulses that are rapid and faint and may be irregular if they have arrhythmias. Their pulse pressures may be low and patients are usually tachycardic. They are seen with jugular vein distension and crackles in the lungs are usually, but not always present. Peripheral edema may also be present. Ultimately, patients develop systemic hypotension, which is systolic blood pressure below 90 torr, or a decrease in mean blood pressure by 30 torr. Next, we'll look at the hemodynamic monitoring and the findings. But first, there are some terms I want everyone to know before we get started. I'll be talking about the pulmonary capillary wedge pressure, or the PCWP, which is an indirect measure of the left atrial pressure, which is measured by wedging a pulmonary catheter with an inflated balloon into a small pulmonary arterial branch, which normally is between 4 and 12 millimeters per mercury. Second, cardiac index. We'll be talking about that as well, or it will come up. So it is a hemodynamic parameter that relates the cardiac output, which is how much blood is being pumped out from the heart, which is typically about 2.2 liters per minute, from the left ventricle in 1 minute to the body surface area, thus relating the heart performance to the size of the individual. Lastly, you'll also get brought up a lot is a Swan-Ganz catheter. It is, they pass it, it's a small tube or catheter that is passed in the right side of the heart and the arteries leading to the lungs. It is done to monitor the heart's function and the blood flow, and then also some of the pressures that is correlated with it. The hemodynamic measurements of someone with cardiogenic shock are pulmonary capillary wedge pressure higher than 15 torr and a cardiac index less than 2.2 liters per minute square meter. The presence of a large V wave on the pulmonary capillary wedge pressure tracing suggests severe mitral regurgitation, whereas a step up in oxygen saturation between the right atrium and the right ventricle is diagnostic of ventricular septal rupture. High right side filling pressures in the absence of an elevated pulmonary capillary wedge pressure when accompanied by an ECG criteria and an electrocardiograph indicates a right ventricular infarction. Next, we're going to talk about some of the pharmacology options that can be given to treat this. Aspirin and heparin is essentially the number one. They've been found to reduce the recurrent myocardial infarction following a PCI and a cardiogenic shock. Given the low perfusion from a lack of oxygen, these meds will help to break up an emboli or a thrombus in the arteries to decrease circulation and perfusion. Well, then it becomes mechanical ventilation and what kind of ABGs you may see upon this. So when it comes to mechanical ventilation, intubation and mechanical ventilation are commonly required with this types of shock. It's necessary, if necessary, positive pressure ventilation and endotracheal tube intubation should be performed. CPAP or BiPAP support can be considered as well. However, although positive pressure ventilation may improve oxygenation, it may also compromise venous return to the heart. So in any event, the patient should be treated with high flow oxygen. They also may be seen with a respiratory alkalosis when it comes to an ABG.